We've all been there, right? Trying to get a fussy toddler to brush their teeth. It feels like this small daily battle. But what if I told you that this simple act is actually at the center of a massive global health story? One that's filled with some really surprising twists about wealth, health, and what it actually takes to protect a child's smile. So let's pull back the curtain on this everyday struggle and see the global health crisis that's been hiding in plain sight.
So let me ask you something. When you think about all the health challenges facing kids around the globe, what comes to mind? What do you think is the single most common chronic disease they face? Maybe asthma? Allergies? Well, the answer is probably not what you're thinking.
It's tooth decay. And the scale of this it's just staggering. A massive 2024 meta-analysis found that the global prevalence of this disease among young children is a whopping 49%.
Let that sink in for a second. We're talking about almost 1 out of every 2 children on the entire planet under the age of 6 being affected by a disease that is, for the most part, completely preventable. This isn't just some minor issue. It is a silent epidemic.
Okay, so what exactly are we talking about here? Well, the scientific name for this condition is early-childhood-caries, or ECC for short.
So what this really means is that ECC isn't just a single cavity. No, it's any evidence of tooth decay in a child's baby teeth. And the key thing to remember is that this is almost entirely preventable. Yet it continues to be a major global health problem, one that affects a child's ability to eat, to grow, and really to just enjoy being a kid.
But here's where the story gets really interesting. This burden, this disease, it isn't shared equally across the globe. When you look at the data, it reveals this really stark divide. It's like a tale of 2 completely different worlds when it comes to children's dental health. Just take a look at this map from the study. It shows the prevalence of ECC around the world. In those green areas like Greece, the rate is relatively low, around 19.3%. But then you look at the areas in red. In the Philippines, the rate is an absolutely shocking 98%. That huge difference just begs the question, why? Well, the first and probably most obvious clue seems to be a country's wealth. I mean, it makes sense, right? Economic conditions would obviously play a huge role in public health. But how strong is that connection, really? To figure this out, researchers looked at a key economic indicator called gross national income, or GNI. Put simply, it's a way to measure the average income per person in a country. It gives us a pretty good snapshot of that nation's overall wealth. And when you look at the numbers, the link is, well, it's crystal clear. In countries with the lowest GNI, we're talking less than $5,000 per person, the rate of childhood tooth decay is a huge 57%. Now, compare that to mid to high income nations, the rate drops all the way down to just 30%. So the connection is undeniable. A child's odds of having healthy teeth are strongly tied to the economic prosperity of the country they just happen to be born in. But this leads to an even more complex and interesting question. Because if a nation's overall wealth matters that much, you'd think that how that wealth is distributed would matter even more, right? It just seems logical. To investigate this, researchers use something called the Gini Index. It's a standard tool for measuring income inequality. Think of it like a scale from 0 to 100. A score of 0 means everyone has the exact same income, perfect equality. A score of 100 means one person has all the money, perfect inequality. So the expectation here seems pretty straightforward. You'd think that countries with a higher Gini score, in other words, more inequality, would have worse dental health, especially for the poorest kids. It seems like an open and shut case. But the data told a very, very different story. Honestly, this was the biggest surprise in the entire study. Against all expectations, there was no significant statistical link between a country's wealth inequality and its rate of childhood tooth decay. In fact, the analysis found that some countries with very low inequality, where wealth was distributed pretty evenly, still had very high rates of ECC. This puzzle tells us the problem is way more complex than just how money is spread around. It kind of suggests we might have been looking in the wrong place for the full answer. So what do we take away from all this? Why does understanding this complex global picture even matter? Well, it matters because it fundamentally changes how we should be thinking about solving this problem. So let's break down the big takeaways here. First, early childhood caries is a massive, preventable crisis. We can't ignore that 49% figure. Second, a country's overall wealth is a huge factor, no doubt about it. But third, and this is the most important part, the solution isn't as simple as just looking at wealth distribution. It's about digging deeper into the specific cultural and social realities of each and every community. And that brings us to this final, really crucial quote from the researchers themselves. Effective prevention can't be one size fits all. It has to be tailored. It means really understanding a community's diet, their access to care, their health literacy, their cultural practices. It leaves us with a big question. How can we move beyond these broad economic solutions and start creating targeted, culturally aware programs that ensure every single child, everywhere, has a real reason to smile?